Hello, and welcome to today's training video.
Medical emergencies can happen anywhere. As healthcare providers, you must be able to recognize and intervene in a variety of emergency situations.
Today we will be learning about shock, all of the signs and symptoms and types of interventions you can take to help save a life.
Before we can identify shock, we have to know what exactly shock is.
Shock is a condition in which our cardiovascular pulmonary system fails to deliver enough oxygen-rich blood to its tissues. The tissues that are being depleted of oxygen attempt to use an anaerobic or non-oxygen pathway of energy. This anaerobic process creates acidosis and toxins that build up and can cause more harm to the body, especially the cardiovascular system.
Shock can be categorized into 4 different types: hypovolemic, cardiogenic, distributive, and obstructive.
Although each type of shock is associated with a different condition, they all follow a sequence of 4 stages.
Stage 1 is where cells begin to be deprived of oxygen. This inhibits the production of energy. This lack of energy prevents the cells from functioning properly, and this can affect all body systems.
Stage 2 is when the body will attempt to make physiological adaptations to compensate for the lack of oxygen. The signs and symptoms of shock are associated with these physiological changes.
Stage 3 occurs when the body's adaptations begin to fail. This causes damage to vital organs. Systolic hypotension will occur at this stage.
Stage 4 is the end stage. This is where cell damage and brain damage have occurred. Death will follow in a few short hours.
But we are not here today to talk about the outcome of untreated shock.
We are here to get you, the healthcare provider, trained to recognize shock in the early stages, intervene, and help save a life. You may have been introduced to the repair model for recognizing and handling shock in the dental office. But here at the Office of Dental Healthcare Provider Preparedness, we have come up with a simpler way to recognize the signs of shock.
When a patient presents with abnormal vital signs or behavior, just think slap.
S is for skin, usually clammy and cool or cold to the touch. In the case of distributive shock, the skin can be warm and pink. So really, anytime a patient presents with skin issues, they should be addressed.
L is for level of consciousness or confusion. Patients suffering from shock are often confused, out of it, or maybe having some unexplained mental state change, including feelings of anxiety.
Anxiety.
A, it's for abnormal situation. Shock usually follows some situation that happened to the patient or is happening to the patient. The most common is there is a hemorrhage happening in the body and some recent trauma or severe dehydration. Cardiogenic shock often follows a myocardial infarction, which is an abnormal situation. And all 3 distributive shocks can occur from situations outside the norm. For example, an anaphylactic reaction, a severe allergy, or an emotional trauma.
P is for pulse. This is another key sign to identifying shock. Pulse is directly related to the cardiovascular pulmonary system, which is being interrupted with shock. The most common irregular pulse will be rapid, thready, and weak.
Now that we know what shock is and what to look for, let's watch a brief scenario.
Taking duties on today's
Hi, I'm
date.
here for my appointment.
Duties for.
Oh, Mrs. Forsky, your appointment is until next week. I'm surprised that you're here so early.
Oh, are you sure? I swore my appointment was today.
Yeah, I'm pretty sure.
Are you sure?
I scheduled it myself.
Okay, so this is the confusing part. So I need to put...
Oh, I guess it's next week?
Yeah, we have you scheduled for next week.
Okay, I'm so sorry.
No, that's okay. I have an opening right now. Do you want me to see you right now?
Yeah, sure, that'd be great.
Yeah, let me come around and I'll come walk you back there.
All right.
So good to see you.
Thank you.
Okay, in this way. Mrs. Flarsky, it's this way. This way. Remember? Right. So how have things been since I've seen you last?
Really great.
Anything new going on?
Not that I can think of.
That's super good to hear. No other incidents with MI since?
No.
Because I know 5 years ago you had one, right? So
Yeah.
nothing else has happened since then?
Not that I can think of.
Oh, that's wonderful. You marked here that you had one 2 weeks ago.
Oh, I did?
Yeah, 2 weeks ago. That's pretty recent. When did you get discharged from the hospital?
For some reason, I can't remember.
Okay. Well, yeah, that's pretty recent. Let's go ahead. Let's just do your vitals.
Okay.
Let's just see where you are right now for today. So let's go ahead and let's stop your pulse. So one thing I'm noticing, your pulse feels a little fast and a little weak and a little thready right now. So I think just because since you had that heart attack just 2 weeks ago, I think instead of doing your dental cleaning today, I think you should just go home and really get some rest.
Are you sure?
Is that okay with you? Yeah, just because we do ask that we need a clearance from your doctor to be able to do the cleaning. So I'll have you go home, just go ahead and rest, and then whenever you get a time next week or even this week to get that clearance from your doctor, and then we'll reschedule your appointment, okay? I'm just thinking about you. I want to make sure that you're okay.
Okay.
All right?
Sounds good.
Okay, let's go
Alright.
ahead and I'll move this for you. Do you have anybody? Are you just driving yourself?
Yeah, it's just me today.
Okay, that's good. That's fine. We'll walk you out. Yeah, I'll give you a call next week and see how you're doing, okay?
Okay.
Okay, bye, Ms. Farsky.
L and the A all smushed together. So it's capital D, E, capital L, A, capital R, O, I.
Ms. Farsky?
Because first off, it's French. But it means the same thing in Spanish, but in Spanish it would be separate.
Goodbye. You'll be fine. Hey, so my patient canceled, so I'm just gonna go ahead and grab something to read and sit down for a little bit.
In this scenario, Sally failed to recognize the signs and symptoms of shock. Although treatment was postponed, the patient was sent home, and the result was death.
Now let's watch the scenario as Sally applies our simple slap system.
Duties on, put today's
Hi, I'm
date,
here for my appointment.
duties for,
Oh, Mrs. Farsky, your appointment isn't until next week. I'm surprised that you're here so early.
Oh, are you sure? I swear my appointment was today.
Yeah, I'm pretty sure.
Are you sure?
I scheduled it myself.
Okay, so this is the confusing
Oh, I guess it's next week?
Yeah, we have you scheduled for next week.
Okay, I'm so sorry.
No, that's okay. I have an opening right now. Do you want me to see you right now?
Yeah, sure, that'd be great.
Yeah, let me come around and I'll come walk you back there.
Alright.
So good to see you.
Mrs. Flarsky's hands seem oddly cold and clammy today. That's very bizarre for her.
Okay, and this way. Oh, Mrs. Flarsky, it's this way. This way. Remember? Right. So how have things been since I've seen you last?
Really great.
Anything new going on?
Not that I can think of.
That's super good to hear. No other incidents with MI since?
No.
Because I know 5 years ago you had one, right? So
Yeah.
nothing else has happened since then?
Not that I can think of.
Oh, that's wonderful. You marked here that you had one 2 weeks ago.
Oh, I did?
Yeah, 2 weeks ago. That's pretty recent. When did you get discharged from the hospital?
For some reason, I can't remember.
Okay. Well, yeah, that's pretty recent. Let's go ahead. Let's just do your vitals. Let's stop your pulse.
That's odd that Mrs. Flarsky is being so forgetful today. And her skin is so cold and clammy. And I can't believe she just recently had a heart attack. Oh man, could this be SLAP? I wonder. Because skin, level of consciousness, abnormal situation, pulse, SLAP, that's it!
Starting to hurt.
All right, so what I'm gonna go ahead and do is I'm gonna go ahead and I'm gonna sit you up, okay? And then I'm gonna lean you back. Can I get a doctor over here, please?
Hi, Sally. How's it going?
It's going well, Dr. Kamesa. This is Miss Flarsky, and I'm suspecting that she is going
Mrs.
into
Flarsky, how are you
cardiogenic
doing?
shock.
My heart is starting to hurt.
She had
Are you
MI about
having-
2 weeks ago.
Are you having difficulty breathing?
Yeah,
Breathing?
I think so.
And it's painful? How long has it been painful?
Just the past minute.
Does it feel like... Miss Flarsky, are you okay? Are you okay? I'm getting no response. Jamie, can you get the medical equipment? Brittany, go ahead and record. Checking her pulse. She does have a pulse. I'm hearing breathing sounds. Okay, go ahead and monitor
Dr.
vitals.
Kamesa, I'm feeling again. I don't feel a pulse anymore.
No pulse?
No pulse.
I need you to activate EMS at the front desk. Okay, we're gonna start.
Miss Rojas, call 911!
We have just witnessed Sally save a life.
With the information you have learned today, you too can save a life.